Hi guys! Congratulations on getting your braces here at Orthodontics at Don Mills. Today we're going to go through the oral hygiene instructions. So I just want to get started and talk about what to expect in the beginning stages of having braces. Everybody is different, so everyone's going to feel things a little bit differently. But definitely most people are going to feel soreness and achiness for the first little bit. I always tell everyone give themselves about a month to get used to the braces. It doesn't mean it's going to hurt for that whole entire time. It's just getting used to all the hardware in the mouth and eating differently and feeling different things that was never there before. So with the soreness and the achiness, basically it feels like having a headache in the mouth. That's generally the overall feeling of what it feels like. So we tell our patients to stick to the softer foods in the beginning, things like yogurts, mashed potatoes, smoothies, rice, pasta, stuff that you don't have to chew too much into, because when you chew, that's when you really feel the pain kind of radiate. So stick to the softer stuff, and Advil and Tylenol if needed, as needed. And again, that's different per person. Some people have a higher tolerance to the braces and the rubbing and the irritation versus other people. So only if needed do you take Tylenol and Advil. Also, with the braces being in place, they are metal, and so they are dry and rough, and it takes some time for the saliva to develop a coating over the braces. And in that time frame, a lot of people get irritation and cuts on the inside of the mouth. So we give wax, and you can get that here from us, and you can order some online. And what you do with the wax is you just take a little piece, you roll it around till it's nice and soft and it's kind of a little bit more pliable, and then you stick it in an area that is rough, rubbing, poking, irritating, causing a cut, whatever the case may be, and it creates a smooth barrier between the brace and your tissue. We also advise our patients to try to use this as sparingly as possible. Again, it's case by case dependent, so if you need it, use it. But with the wax, the more you use it, the longer it takes for your tissue to toughen up, develop that callus, and get used to the metal rubbing against the inside of your cheek. But it's there if you need it, and if you run out, you're always more than welcome to call us and get more, or you can order some online. Now, in terms of brushing and flossing, it is so important to brush and floss after every single meal. You should be brushing for 3 minutes at a time every time that you eat something. We know that is not always possible for majority of people that are in school or at work. It is quite difficult. So we do advise that you brush after breakfast, when you get home from school or work, and then before bed. And you should be brushing for 3 to 4 minutes at a time, and then flossing before bed. And also you can rinse with some warm salt water just to keep things healthy and clean. You could also use water and baking soda as well. And that just helps keep everything clean before you go to bed, because that's the easiest time for food and plaque to kind of sit and rest and not be washed away by your tongue and saliva while you're sleeping, and it creates this perfect breeding ground for bacteria and cavities, essentially. So when you're brushing, it's all about the angles, and with a regular brush or powered brush, you're going to angle the bristles. So what you want to do is angle the bristles at a 45-degree angle towards the gum line, gently massaging and sweeping under the gum, and then away, always away from the gum. So whatever is sitting and resting at the gum line, you're brushing it and removing it. And then you want to brush on top of the brace. You want to do a circular scrub around the brace and then underneath the brace. So that's how you want to clean around the braces. And then also you cannot forget about the chewing area. So you want to make sure that you're getting into the crevices of your chewing area, and you want to get in there and circular scrub. But also on the inside, again, you want to angle the bristles towards the gum line, gently massaging and sweeping away. And then when you're doing the bottom, it's the same thing, just reverse. So you want to angle the bristles towards the gum, gently massaging and sweep up. So always away, you never want to sweep down, and you don't want to scrub your gums back and forth, because that will wear them away and cause recession. And so we want to just gently massage, but always keeping the gum line clean, and sweep away from the gums. Then with flossing is going to be different. It is definitely a little bit more challenging. It's going to take longer to floss. It is all about consistency and patience with flossing. But you're going to get floss threaders from us. And again, you can also order floss threaders online if you run out, or come by and grab some from us. One end of that floss is stiffened so that you're able to get between the wire and the tooth. So essentially what you're going to do is you're going to drop the stiffened end between the wire and the tooth, and then you're going to pull it through, and then you're going to wrap your fingers around the floss on both sides, nice and tight, so you have a good grip on the floss, and then you're able to floss one side of one tooth and the other side of the other tooth. And you want to do a C shape around until you feel resistance, and then gently bring it back up, let go, and pull it through until it comes completely out. Don't ever pull the floss up because you could bend the wire. So you want to make sure you're pulling it completely through and out, and you have to do that in between each set of every brace. When you're out and on the go, if you're not able to have access to your toothbrush, if you're at a dinner or at a friend's house and you don't have your toothbrush, there are these little proxy brushes that are very handy. They do not replace brushing or flossing. They just tide you over to the next time that you can. So with this little proxy brush, what you do is if there's something stuck in between the brace and the wire, you just brush it and remove it. And then you can brush on top of the brace, around the brace, wherever there's something stuck, and then you rinse and spit. And these guys are reusable, but they will break down and you will have to toss them and get a new one, just like a toothbrush. So eating with braces also is very different. It is tricky and it is a huge learning curve. So when you're eating, you want to be careful with the foods that you're eating. You want to avoid hard and sticky foods, things like caramels, gums, toffees. Anything that is sticky and tacky that has a pulling motion can have a chance to pull the brace off. So we want to reduce the number of braces that our patients break, because it does slow down the treatment time, and it is a little bit of a pain to come in and have to have things fixed. So being careful with the foods that you're eating is super, super important. So you want to avoid the hard and sticky candies, caramels, toffees, gums, Jolly Ranchers, Starburst, those kind of things you want to steer clear of. And anything hard that you have to bite into, like an apple, or an apple's the best example, but anything hard that you have to bite into, you want to cut it up into bite-sized pieces and place it towards the back, towards the chewing surface, so that you have more of a surface area to eat with, versus something hard like an apple that you're biting into that you can knock off a brace. So that's the trick with eating with braces. And that is the best way, is basically anything that is hard, anything you have to bite into that is hard, you want to cut up, place towards the chewing surface, and just modify how you're eating it. You can eat everything, you just have to modify it. And again, stay away from the sticky foods, caramels, toffees, Jolly Ranchers, Starburst, things like that. What else can I talk about? During treatment, you will likely be prescribed elastics. Everyone gets them, and they are so vital to wear 24/7. You have to. These lovely elastics come from us and only from us. You cannot order these online. And the purpose of the elastics are for bite correction. If you don't wear these properly, your bite's not going to be on and you're going to prolong your treatment time. So Dr. Noble will prescribe the elastics and the position of the elastics, but essentially what they're for, like I said, is to get your bite to fit as well to this as possible. So they're only out of your mouth for eating, brushing, and flossing, and that is it. Otherwise, they're in your mouth 24/7. I think that's all for braces today. And if you guys ever have any questions, concerns, or emergencies, you're always welcome to give the office a call, and one of our team members will be happy to direct you. Enjoy.